Welcome to our channel, Medicine A to Z. Today, we are going to discuss some multiple-choice questions on COPD. Which of the following is a characteristic feature of chronic bronchitis? A. Enlargement of air spaces distal to the terminal bronchioles. B. Presence of dyspnea and evidence of hyperinflation on examination or imaging. C. Chronic productive cough for at least 3 months in each of 2 successive years. D. Evidence of airflow limitation. C. Chronic productive cough for at least 3 months in each of 2 successive years. Chronic bronchitis is defined as a chronic productive cough over a defined period, typically for at least 3 months in each of 2 successive years, in a patient in whom other causes of chronic cough have been excluded. This definition has been used in many studies to characterize chronic bronchitis. Options A, B, and D describe features more closely associated with emphysema and airflow limitation rather than chronic bronchitis. Which term is used to identify individuals who have respiratory symptoms, radiographic abnormalities consistent with COPD, or early lung function changes, but do not meet the criteria for airflow obstruction as defined by FEV 1 to FVC ratio less than 0.7? A. Pre-asthma. B. Pre-COPD. C. Asthma-COPD overlap. D. Post-COPD. Answer B. Pre-COPD. Pre-COPD is the term used to identify individuals who have respiratory symptoms, radiographic abnormalities consistent with COPD, or early lung function changes, but do not meet the criteria for airflow obstruction as defined by FEV 1 to FVC ratio less than 0.7. This group is at high risk for developing COPD. What is the purpose of pursed-lipped breathing in patients with emphysema? A. To regulate filling of the lungs that have increased compliance. B. To increase airway pressure during expiration to reduce air trapping. C. To alleviate chest discomfort during inspiration. D. To trigger a reflex response to severe breathlessness. Answer B. To increase airway pressure during expiration to reduce air trapping. Pursed-lipped breathing involves exhaling through pursed lips, which creates back pressure in the airways, slows down breathing, and helps prevent the collapse of small airways. Which of the following cellular components is more commonly associated with bronchial inflammation in chronic bronchitis and emphysema? A. CD4 plus T lymphocytes and eosinophils. B. CD8 plus T lymphocytes and neutrophils. C. Macrophages and interleukin-4, IL-4. D. Mast cells and interleukin-5, IL-5. Answer B. CD8 plus T lymphocytes and neutrophils. Chronic airway inflammation in chronic bronchitis and emphysema is frequently characterized by the presence of CD8 plus T lymphocytes, neutrophils, and CD68 plus monocytes, macrophages. In contrast, asthma bronchial inflammation is more often characterized by the presence of CD4 plus T lymphocytes, eosinophils, and increased interleukin 4 and 5. Which of the following conditions is most commonly associated with Pannicular emphysema? A. Cigarette smoking. B. Alpha-1 antitrypsin deficiency. C. Coal workers' pneumoconiosis. D. Chronic bronchitis. Answer B. Alpha-1 antitrypsin deficiency. Pannicular emphysema refers to enlargement or destruction of all parts of the acinus and is most commonly associated with alpha-1 antitrypsin deficiency. Centrilobular emphysema associated with cigarette smoking and coal workers' pneumoconiosis. Which of the following symptoms is most commonly reported as an early symptom of COPD? A. Wheezing. B. Chest tightness. C. Chronic cough. D. Exertional dyspnea. Answer D. Exertional dyspnea. The most common early symptom of COPD is exertional dyspnea. Which risk factor is most strongly associated with the development of COPD? A. Exposure to household biomass smoke. B. History of childhood asthma. C. Premature birth. D. Human immunodeficiency virus, HIV infection. A. Exposure to household biomass smoke. Exposure to household biomass smoke is a significant risk factor for the development of COPD, particularly in regions where biomass fuel is commonly used for cooking and heating. While other factors such as childhood asthma, premature birth, and HIV infection may contribute to the development of COPD, Exposure to household biomass smoke is more strongly associated with the disease. Which of the following physical examination findings is characteristic of end-stage COPD? A. Clubbing of the digits. B. Prolonged inspiratory time. C. Hyperresonance to percussion. D. Paradoxical retraction of the lower interspaces during inspiration, Hoover sign. Answer: D. Paradoxical retraction of the lower interspaces during inspiration, Hoover sign. In end-stage COPD and chronic respiratory failure, patients may exhibit paradoxical retraction of the lower interspaces during inspiration, known as the Hoover sign. This is indicative of severe hyperinflation and diaphragmatic flattening. Other signs of end-stage COPD include the adoption of positions to relieve dyspnea, use of accessory respiratory muscles, cyanosis, asterixis, also known as the flapping tremor or liver flap, due to severe hypercapnia, and an enlarged tender liver due to right heart failure. Options A, B, and C are not typical findings of end-stage COPD. Clubbing of the digits, for example, suggests comorbidities rather than COPD itself. Which of the following statements regarding screening for COPD using spirometry is correct? A. Population-based screening of asymptomatic adults with spirometry is recommended. B. The capture questionnaire has low sensitivity and low positive predictive value for detecting COPD. C. Patients with a capture questionnaire score of 0 to 2 are at higher risk and should undergo spirometric evaluation. D. Asymptomatic mild airflow obstruction always requires treatment. Answer: B. The capture questionnaire has low sensitivity and low positive predictive value for detecting COPD. The capture questionnaire has been shown to have moderate sensitivity and high specificity for detecting COPD. Options A, C, and D are incorrect. Population-based screening of asymptomatic adults for COPD with spirometry is not recommended. Patients with a capture questionnaire score of 0 to 2 are at lower risk, and asymptomatic mild airflow obstruction does not always require treatment. What is the recommended threshold for establishing airflow limitation in the diagnosis of COPD? Answer C. Post-bronchodilator FEV1 to FVC ratio less than 0.7. Which alternative measure can be used as a surrogate for FVC in spirometry? A. Forced expiratory volume in 1 second. B. Forced vital capacity in 6 seconds. C. Forced expiratory volume in 6 seconds. D. Peak expiratory flow rate. Answer C. Forced expiratory volume in 6 seconds. FEV6 can be used as a surrogate for FVC in spirometry. It has advantages such as shorter testing time and better repeatability. Which of the following radiographic features is not suggestive of COPD? A. Rapidly tapering vascular shadows. B. Increased radiolucency of the lung. C. A widened heart shadow. D. A flat diaphragm. Answer: C. A widened heart shadow. Radiographic features suggestive of COPD include rapidly tapering vascular shadows, increased radiolucency of the lung, and a flat diaphragm. A widened heart shadow is more suggestive of conditions like pulmonary hypertension and cor pulmonale, which can occur as complications of advanced COPD. Which system categorizes COPD patients into 4 stages based on the forced expiratory volume in 1 second to forced vital capacity ratio? A. Gold classification system. B. Bode index. C. COPD foundation system. D. Star severity classification scheme. Answer: A. Gold classification system. The Gold classification system categorizes COPD patients into 4 stages based on the FEV1 to FVC ratio and FEV 1% predicted. How does the Global Initiative for Chronic Obstructive Lung Disease, GOLD, categorize patients with COPD for the initiation of therapy? A. Based solely on airflow limitation severity. B. Based on symptoms and risk of future exacerbations. C. Based on age and gender. D. Based on the presence of comorbidities. Answer: B. Based on symptoms and risk of future exacerbations. Which group of COPD patients is characterized as less symptomatic with low risk of future exacerbations? Group A. Group B, Group E, Group D. Answer: A. Group A group. A consists of less symptomatic patients with low risk of future exacerbations, characterized by MMRC grade 0 to 1 or CAT score 10 and 0 to 1 exacerbation per year without hospitalization.